right, hello everybody. I'm Pete Cheney, MCAA's Director of Safety and Health. Thank you for joining us and welcome to today's webinar, Guidelines for COVID-19 to Help Protect Mechanical Industry Workers. This is actually the fourth webinar in MCAA's COVID-19 Contingency Plan webinar series, but it's really the first one that we've done this geared specifically toward worker protection. MCAA and the UA work very closely together on to establish the guidelines that you're going to learn about today. And much of that content actually came from the International Association of Plumbing and Mechanical Officials, more commonly known as IAPMO, and the American Society of Sanitary Engineering. So we thank both of these organizations as well as our great friends at the UA for partnering with us to make today's webinar possible. I got to tell you, I'm honored to be part of this joint initiative. It's one that's aimed at helping protect our workers from the spread of COVID-19, and it's very much a privilege for me today to introduce our hosts. Most of you already know my very good friend, Cheryl Ambrose. She's the UA's Health, Safety, and Environmental Administrator, and she's going to be the one that's moderating the questions for us today. But I got to tell you, over the past several weeks, Cheryl has made herself readily accessible to MCAA day and night, 7 days a week, and we have more than once taken advantage of that generosity. So, Cheryl, we thank you, and we really hope that you know how much we appreciate you. I also want to introduce two other industry experts from the United Association. Originally from Plumbers Local 27, we have Tom Bigley. Tom is the UA Director of Plumbing Services. And also today we have Brian Kelly. Brian is the UA Director of HVACR, and he's originally from Pipe Fitters Local 537. So these two gentlemen, along with Cheryl, were instrumental in developing the guidelines. And they're here today to answer questions that fall into their respective areas of expertise. So Tom and Scott are going to handle the plumbing related questions, and Brian's going to field the HVACR related questions. So thank you both very much for being with us today. And by the way, please keep your questions today specific to our worker protection guidelines. Just for today's webinar, let's defer labor management, collective bargaining related questions, that kind of thing. Let's just defer that. So our presenter today is also MCAA friend Scott Hamilton. Scott is originally from Plumbers Local 75, and he's currently the Senior Director at IAPMO, and he's also the Senior Director at ASSE. So he's wearing a couple of hats these days. Many of you met Scott at our Safety Directors Conference back in January. He presented two sessions addressing ASSE 12,000 infection control and water management programs. If you're not familiar with ASSE 12,000, you are going to learn a little bit about it today. But I'm telling you, Scott has tremendous expertise on infection control, and he actually provided most of the information that make up our COVID-19 worker protection guidelines. So, and I mean, Scott is just the ideal person to present this webinar for us today. So Scott, thank you so much for all that you do for our great industry. We're very much looking forward to this webinar, and with that, I'm turning it over to you, buddy. You've got the ball.
All right, thank you, Pete. That was very kind of you. Today's presentation, the purpose of it is to provide guidance to protect the health of workers performing work on plumbing and HVAC systems. And like Pete mentioned, the information that we obtained from OSHA, from CDC, ASSE, IAPMO, and ASHRAE. And what we did as a team is we kind of took that information and combined it together to come up with what we consider would be best practices to keep our people safe out there while doing the essential work that we do. You know, today's not typical one of your normal type days in this world, and we realize that, and you have to be able to adapt and move forward to something that's a little bit less than what we're used to, and that's what we're trying to go over today. So first thing we have to do is understand what it is we're trying to protect ourselves from. Coronavirus, it comes from a large family of viruses found in humans and animals, and it's been around for a while. Healthcare officials and researchers have known this since at least the mid-60s. So the coronavirus itself is not something new. It is responsible for upper respiratory infections with range from a common cold to death. In 2002 and 2003, a new animal coronavirus called SARS, which stands for Severe Acute Respiratory Syndrome, emerged in humans in southern China. And this is where the problem occurs. Is coronaviruses are in animals or in humans. When it jumps from an animal to a human, that's when we start to worry and things start to happen that's bad.
Hey, Scott,
Yes.
your screen's not sharing, so if you could just share your PowerPoint, please.
Yes, sir. Hold on one second.
And perfect. Let's go ahead and just go full screen and you're set. Thank you.
All right, thank you. All right, so in 2003, we talked about the SARS virus. It spread throughout 29 countries around the world. There was a total of 8,098 individuals that were infected, resulting in 774 fatalities. 2019, a new pandemic outbreak of another coronavirus was discovered in Wuhan, China. This new coronavirus is called SARS-CoV-2, and it causes a disease known as COVID-19, which everyone is hearing about, everybody is dealing with. This one is spreading much quicker than the 2003 SARS outbreak. To date, and I will get you the official to date number from Johns Hopkins, we have over 495,000 confirmed cases worldwide with over 22,000 fatalities, and it's in 175 different countries and regions. So you can see how that has changed since the last couple of days I updated my slide. It is growing and continuing to spread very rapidly throughout the world. Because this virus can be easily transmitted between humans, the World Health Organization has qualified this virus as a pandemic. And again, all predictions are this is going to continue to spread quickly. So how do you get infected? We know what it is we're protecting ourselves against. How do we get it? The disease is spread by close person-to-person contact, and that's important to remember when we go through this whole presentation. Person-to-person contact is how this thing is going to spread. It's going to usually occur from a cough, sneeze, somebody exhales, or close talking could be another possibility. And what happens is droplets that are infected with the COVID-19 gets into another person's mouth, nose, lungs, and they become now infected. Now, most of these droplets, especially if you keep the social distancing, is going to not hit another person. It's actually going to fall on objects like desks, phones, tables, anything around you is where the droplets could land. People can catch COVID-19 by touching contaminated surfaces or objects and then touching their nose or mouth. It's unclear right now exactly how long a virus can remain contagious when exposed on a surface. Some researchers are stating that it can remain airborne for up to 3 hours, which is definitely a concern. It can survive on cardboard for 1 day, up to 1 day, and up to 2 to 3 days on steel or plastic. Now, these numbers depend on a lot of variety of variables. Again, it was in a controlled environment that they did these studies. So again, depending on what type of work site or what type of setting you're on, could vary. But basically, if we remember that it's person-to-person contact, and COVID-19 spreads similar to the way the flu does, and it's very, very infectious. So let's take a look at what a virus actually is. A lot of the classes that we conduct, we talk about viruses and bacteria and other pathogens that affect us. So we need to understand what a virus is. And if we understand what a virus is, we kind of know how to protect ourselves already because we've been exposed to viruses for decades. So first of all, bacteria, the bacteria that comes to mind that's common right now that everybody's talking about is Legionella. And Legionella can survive. It survives in the water system. It's a waterborne pathogen, different than a virus. So don't get the two confused. A virus, you see the comparison, a virus is the smallest of all life forms. It's also the simplest life form. It needs to survive in a host, in a human person or animal to survive. Otherwise, once it leaves that living host, it begins to die. How long it takes to die, again, that's what researchers are looking at. It also uses the host genetic material to reproduce. So it needs to, it sounds strange, but it needs to work with you because it needs you to stay alive in order for it to stay alive. And that's what makes it dangerous because it wants to reproduce in you, it wants to grow, and then it also wants to spread and find other hosts. It is the most harmful between the two. And if you take a look at the two little pictures up there on the top right, the lower one on the right, that is bacteria. You see how smooth it is, survives on its own. Top left-hand one there, that's virus. Any kind of virus you're looking at is going to be some kind of circle in it, and it's going to be spikes sticking out of it. And these spikes, when it enters your system, your respiratory system, those spikes are what attaches to your cells, and that's how it feeds itself, and then it multiplies through that. So whenever you see those spikes on something, that's going to be the virus. So what are the symptoms? Most infected with COVID-19 experience mild symptoms and recover. All right, and you hear some reports are saying 80% of people are going to get it. Some don't even know they have it, and you're going to recover, and everything is fine. But you still got to keep in mind that once it's in you, you're now a carrier of it. And now you can spread it to others, and others that are in the high risk category that we're going to get to. And some are going to experience a little bit more serious illness, and some are going to even require hospital care. And that's where a lot of people are becoming cautious and very scared about what's happening, especially when you look at New York and Louisiana's going to hit it. Detroit is starting to hit it. California is starting to hit it. They're running out of space in hospitals, and they have to get creative. And we're talking about infectious diseases, so you can't mix and mingle patients together that have an infectious disease with somebody who has something else, because it's going to spread. So factors that may cause higher risk, we're looking at age. CDC says 60 years or older are at a greater risk. And individuals with weakened immune systems and people with conditions such as diabetes, heart and lung disease, they're at the greater risk. So for our workforce out there, if you fall into that high risk category, you might want to consider carefully what type of job site it is that you're going to. If it's, again, we're talking about existing job sites where there's people are occupying the buildings and the HVAC and the plumbing's being used, and you're tying into a sewer, you're going to do some vent work or whatever it may be that you're tying into the drain, waste, and vent, you might want to reconsider if you're in that highest risk group. Possibly this may not be the best for me at this point in time. Symptoms of COVID-19 include fever, cough, shortness of breath. One of the questions that's been asked quite often is, can it spread through drinking water? According to the CDC, the SARS-CoV-2 virus has not been detected in drinking water. Conventional water treatment methods that filtrate with filtration and disinfection should remove or inactivate the SARS-CoV-2 virus that causes COVID-19. Remember, it's a virus that has to live in a human or an animal. If it's in the water system, it is starting to die. Can it be spread through sanitary drain, waste, and vent systems? According to CDC, it can survive in human feces for a period of time. How long and how contagious it is, we don't know. Nobody knows right now. There was a report, and this was documented in an IAPMO article and in the white paper. The Chinese government identified an outbreak in a sanitary drain and vent system in Hong Kong. It took place in a 30-story high-rise building, kind of a low-income type building. The sanitary drain and vent systems were altered, which resulted in the vent connections in the building remaining open and not reconnected, which is going to lead to a whole bunch of health problems besides COVID-19. But COVID-19 is what was they found, and there's a large outbreak of it, and they evacuated the whole building because of it. A quote from the white paper, therefore, as long as the pandemic is still active, it should be assumed anyone working on sanitary drainage systems that the virus is present. Always assume the worst. Always assume the worst and be pleasantly surprised if it's not that. How do mechanical tradespeople protect themselves? All plumbers and HVAC technicians working on these systems are strongly recommended to wear PPE, including full face shield worn over safety goggles, impermeable gloves, and protective clothing. These are essential to protect against the potential contact with water and aerosols that contain the coronavirus, and we're working on sanitary systems or sewers. Again, universal precautions. Assume that everything inside that system is contagious. When you cut into a drain line, it is the wild west of pathogens. You've got waterborne pathogens, you've got bloodborne pathogens, you've got airborne pathogens. Already you're exposed to it. Everyone working in that environment is exposed to it. So you need to protect yourself and the other coworkers around you. OSHA standards. These are some of the tools that we use to protect ourselves. The regulations that OSHA set forth. We want to follow all OSHA standards 29 CFR 1926, which is the safety and health regulations for construction, and relevant 29 CFR 1910 for general industry requirements. We listed quite a few of them here. These are the relevant ones that pertain to the COVID-19 that we're talking about. By no means it's all of them. And again, remember, you follow all OSHA regulations where it pertains to your work site. Again, I'm not going to go through all of these. It's just a list for you to take a look at. And when you have time, if you want, look them up and see what it pertains to you. Personal protective equipment for working on sanitary drain and sewer systems. Mechanical tradespeople working on sanitary drain and sewer systems should be provided proper PPE and training how to properly use the PPE and hand washing facilities. Workers should wash hands, arms, and face in that order with soap and water for at least 20 seconds each part immediately after removing the PPE. The following PPE is recommended for workers handling human waste and sewage. Safety goggles to protect your eyes from splashes, human waste or sewage. Protective splash proof face shield to protect your nose and now your mouth also from splashing. Respiratory protection. We're talking about a NIOSH approved N95 mask for the aerosols that may also become in contact with your nose and your mouth. Liquid repellent coveralls such as Tyvek, keep the human waste and sewage again from your skin and your clothing. Rubber outer gloves to prevent exposure from human waste. And then nitrile inner gloves to prevent exposure when removing the PPE and cleaning the tools, which we're going to get into a little bit later on in the presentation. Then also rubber boots to prevent exposure, protect your feet from coming in contact with human waste. Now, I know a question that's going to be asked, and I know I've been hearing everything that's out there. Some of this PPE that we're talking about is near impossible to get. And even if we do have it, I highly recommend that you forward the N95 masks, the nitrile gloves, and the Tyveks to the healthcare providers and the first responders. They are our first defense against this, and they need this. You see it on the news all the time. They need this more than we do. So we cannot afford to have them start coming down with COVID-19 because then we'll have nobody left to take care of the rest of us. So they're in dire need of it. If you do have it, I strongly suggest you forward it on, donate it on to them. And we're going to get into a little bit later on in the presentation how we can cope with not having some of this. We know what to do. We just have to think about it a little bit. And we're going to cover that at the very end. Additional best practices recommendation for PPE. Wear 2 liquid repellent protective suits, an outer suit and an inner suit for additional protection during the work, during the cleaning of tools and equipment after the work is complete. And upon completion of the work, the following procedures should be followed. Carefully remove the outer suit and glove by rolling inside out. The last thing you want to do is if you did come in contact with sewage and it's contaminated, the last thing you want to do is just pop that thing off and just have things spray all over the place, or take it off and set it down someplace and have something else get contaminated. So we want to take time, roll it inside out so the contaminant is rolled inside itself and it's not going to come in contact with anything else. You need to remember that. Place it then in a plastic bag that can be sealed. Doesn't have to be anything fancy, just something that is going to contain it. You can duct tape the top of it and twist it and tie it amongst itself just so that the contaminants stay within the plastic bag and it can be disposed of properly. Complete cleaning of tools and equipment. We're going to go over that a little bit later in the presentation. It's in the guidelines. Remove the inner suit and gloves the same way you did the outer one. And now this time you have to be careful too. Once it's done, now you're exposed too. So you have to be careful that you're not coming in contact with anything else that may be contaminated. You're going to wash your hands, your arms, and your face in that order with soap and water for at least 20 seconds. Again, immediately after you remove the PPE. And then keep your PPE clean by following the manufacturer's instructions carefully. Always important. Major note here. There is a huge difference when we're talking here between doing the work in a healthcare facility or a healthcare setting than it is in your typical occupancy. In a healthcare setting or healthcare environment, they're going to have an infection control risk assessment program. You're going to need to follow that. They're going to dictate to you certain things like anti-rooms, wearing and removal of PPE, cleaning of the tools, removal of waste, paths of travel. So if you're working in a hospital or healthcare facility, nursing home, wherever it may be, you're going to have to ask to see their ICRA program. You're going to have to get trained and up to speed on their ICRA program. Hopefully you're part of the the project early enough that you have say in what the ICRA program, because they need your expertise when they develop the ICRA program too. We know how to install our systems. We know what it takes to install our systems. They don't. They don't have an idea what it takes. They have a little bit, but not much. So it helps when you can get in early and work together and form that ICRA plan. They know how to protect the patients, which is important, without a doubt. They're all immunocompromised. We know how to protect our people, and we know what it takes to get the work done. So we need to work together whenever possible to develop the ICRA programs. And the ICRA program is constantly changing, constantly changing. So you need to have the training, you need to be up to speed on how to protect yourself and the patients in those healthcare facilities. Said outside of healthcare facilities, these best practices are going to work for you. In a healthcare facility, follow the ICRA program. So PPE for working near plumbing, vents, rooftop HVAC equipment, specifically exhaust fans. What we're looking at here, mechanical tradespeople working near plumbing vents, rooftop HVAC equipment, exhaust fans should be provided PPE, training on how to use the PPE, and hand washing facilities. And same thing, when you are done, you're washing your hands, your arms, your face for at least 20 seconds apiece. The following PPE is recommended for HVAC workers working near plumbing vents and rooftop HVAC equipment, specifically exhaust fans. We're talking just about the same thing. We're talking safety glasses with a face shield, again, protecting your eyes, your nose, and your mouth from any kind of splashing. Respiratory protection, the NIOSH N95 face mask or half-face respirator with HEPA filters to protect against inhalation from aerosol transmission. Protective suits, coveralls such as Tyvek, again, protect your skin against any kind of aerosol transmission. Cut-resistant outer gloves, protect from cuts and tears of your inner nitrile glove, 6 mil thickness or greater. That's going to prevent against exposure of liquid. And when removing the PPE and cleaning your tools, you want to wear the nitrile gloves to protect your hands. And then disposable booties to protect against the contamination of your work boots. Again, those droplets, they may land on the ground, and you're kneeling, you're working on it, and you want to make sure that your boots aren't contaminated too. And just one of the very strange, weird things that I always did when I was working in the field, my boots never came in the house. Never came in the house because I don't know where they've been. I know where they've been, but I don't know what they came in contact with. And I wasn't going to bring that house and expose it to my family. So again, rubber boots or protective boots with the protective coverings. Important note related to electrical safety for COVID-19 only. When working on energized electrical conductors or circuits, make sure you're protected first and foremost from arc flash and electrical shock hazards by complying with NFPA 78/2018. Use all compatible protective measures against COVID-19, such as wearing an N95 face mask or respirator under your arc flash face shield and following through on the hygiene practices described in these guidelines. Once troubleshooting is completed, shut off the power, lock it out, test it's dead, remove your arc flash and electrical shock PPE, and wear the appropriate PPE for protection against the COVID-19 described in these guidelines before completing your work. Again, healthcare facilities. I can't emphasize this enough. When you work in a healthcare facility, you're going to follow the ICRA program. So we talked about cleaning your tools. Here's the procedures that's recommended for cleaning your tools. First of all, it's important to have a clean work area. Again, contaminants on the work area, on surfaces, you want to make sure that the work area is clean. Especially when you are done and you're completed with the project, you want to make sure that you disinfect and clean the work area. Cleaning tool practices are also important, and we're going to go through these procedures. One, avoid sharing tools with coworkers to the greatest extent possible. I worked with some guys that were really good at that. You're not going to use their tools no matter what. You're not touching their tools. Now it's actually important. You try to avoid sharing tools whenever possible. When choosing cleaning chemicals, look for cleaning agents effective against viral pathogens. In healthcare facilities, you want to try to use the one that they use on site. Again, it's approved in their procedures. Everything they do in a healthcare facility has procedures, and it's the one that's already approved. It's the one where the Joint Commission comes in and they say, okay, this is what you're using. Let's make sure this is what you're using. And it's an odor and a smell that they're used to. The last thing you want to introduce in a healthcare facility is a strange odor or smell. People are already at edge, people are already stressed out. You don't want to introduce something that's different to them. So in a healthcare facility, try to get permission or try to find the same type of cleaner that they use. It's going to help you out. If such cleaning agents are not available, use soap and water and dry the tools thoroughly after use. You can also use your homemade solution, a bleach solution, by diluting 1 part household bleach with 10 parts water. You want to spray onto the surfaces or soak items in solution. And if you're not sure if your disinfectant is sufficient enough, EPA has a website, www.epa.gov, under List N. It's disinfectants for use against SARS-CoV-2 that you can look up and see. Now let's get into training. Training for our workers. All workers who handle human waste or sewage should receive training on disease prevention. The training should include basic hygiene practices, use and disposal of PPE, proper handling of human waste or sewage. Workers must also be urged, very important, to promptly seek medical attention if displaying any signs or symptoms such as vomiting, stomach cramps, or diarrhea. You got to take yourself out of the game. You got to let people know this is happening. It's to protect yourself, and it's also to protect your coworkers and others in that occupancy. You need to do this, especially in today's time frame. It is recommended that tradespeople be trained and certified to the ASSC Series 12,000. It's also recommended that contractor representatives be trained and certified to the ASSC 12,020 standard. So you ask, what is the ASSC? ASSC International Series 12,000 standards, the professional qualification standards for infection control and risk assessment for all building systems. It's a standard that sets minimum criteria for training and certification of pipe trades, craftspeople, and other construction and maintenance personnel on how to work safely in an environment with potentially deadly diseases that may be present within work sites. It is intended to protect worker and the occupants. It's different than what OSHA is. OSHA protects workers. CDC protects occupants. The 12,000 kind of combines the two and trains the individual how to do both, how to understand why it's important to do both. So it kind of breaks down to this. In the ASSC Series 12,000, we have several standards within it. All deal with infection control. The 12,000, again, is infection control for the tradespeople, how to work safely while being exposed, and how to protect the occupants, especially in healthcare facilities and nursing homes or any place where immunocompromised people are. You need to protect them also. 12,020 is the same thing, except now the contractor version. So it kind of gives them an idea of maybe things you have to look at when you're doing estimations, timeframes, scheduling, PPE requirements, record keeping. It's on more on the contractor side of what they need to do to be also prepared. And how to work together with the hospital. When I said developing that ICRA program, how to speak their language, we kind of go into training on that also, so that's important. And then the 60 series, 12,060, those are water quality, water management programs. The 60 is for the employer representatives. 61 is for the plumbers. 62 is for the pipe fitters, HVAC technicians, and 63 is for the sprinkler fitters. Right now, ASSC International is making the ASSC Series 12,000 standard available for free at their website, which is listed there, while the pandemic remains open. So take advantage of it during these bad times. A lot of you are stuck at home. Download it, take a look at it, see if it's something of interest to you, see if it's something that can help you out. If it is, feel free to contact any one of us and we can help you out with that. The ASSC 12,000 certification training addresses viruses, including SARS that we talked about. Right now, currently, it does not specifically reference COVID-19. I can guarantee you that it will really soon. CDC recommendations. And again, you can visit www.coronavirus.gov and you can find these. They're always being updated, being kept current. So I advise that you keep a hold of this website right here and visit it frequently. The CDC recommends that workers perform the following prevention protective actions generally and while working. Wash hands frequently with soap and water for at least 20 seconds immediately after working on a sanitary waste and vent system. Avoid touching face, mouth, eyes, nose, or open source cuts while working on a sanitary waste and vent system. Avoid working on a sanitary waste and vent system. After working on a sanitary waste event, wash hands with soap and water for at least 20 seconds before eating or drinking. After working on a sanitary waste and vent system, wash your hands again for 20 seconds before using the toilet. Before eating, remove soiled work clothes and eat in a designated area away from where you're working, away from where the sewage and waste was going to be. Do not smoke or chew tobacco or gum while working on a sanitary waste and vent system. Keep open sores, cuts, and wounds covered with dry, clean bandages. Very important. That's another avenue for bacteria and viruses to enter into your body. So any kind of skin that's not intact or any kind of cut that you have, you want to make sure that's covered and protected. Gently flush eyes with safe water if human waste or sewage contacts the eyes. Use waterproof gloves to prevent cuts and contacts with human waste or sewage. Wear rubber boots. Remove rubber boots and work clothes before leaving the job site. And what CDC recommends is to clean your work clothes daily with a 0.05% chlorine solution, which could be 1 part household bleach with 100 parts water. But they say the hygiene of this is important, again, to battle this virus. Clean and disinfect tools and equipment used, and we went through those procedures already. Clean and disinfect work area frequently. Cover your cough and sneeze with your bent elbow. This, not this anymore. There's nothing more disturbing than someone doing this and then shaking your hand. So bent elbow is what we want to do. In your hand, now you're touching tools, you're touching different things, you're contaminating different areas. You're not going to touch a lot with the inside of your elbow. It's pretty tough to do. Do not report to work if you feel ill. Again, now you're immunocompromised. You're not sure what it is. You don't want to pass it on to anybody else. And you don't want to catch the COVID-19 now that you're immunocompromised, because now you're at that higher risk again. Report and document all exposures. If you start to feel ill, report to your supervisor immediately and document the incidents. It's important that people know what is going on. So if something bad does happen, they can go back and trace it and follow through with it. Important to document. Currently, there's not a vaccination or medication for COVID-19, but it is recommended that other vaccines be kept current. Again, you don't want to get infected with something else. Not at all. Then your immune system is weakened, and then that's when the COVID-19 can really take hold. If you go to the CDC website, it's located on the bottom of this slide here. They have a whole bunch of things that you can download for free. This one is the hand washing thing. We've gone through it already. But again, things that you can use, you can post on the job sites, you can post at your office, wherever it may be. Different things that you can use. Social distancing, cannot emphasize this enough. It is important to follow social distancing recommendations. Try to keep a minimum 6 feet distance between others. Remember, it could take anywhere from 2 to 14 days for COVID-19 symptoms to appear, if they even appear at all. If you take a look at the diagram on the right, this is what we call the chain of infection. Now, chain of infection, whenever there's an outbreak like this and you try to isolate or you try to mitigate like we're trying to do now, this is what social distancing does, is it wants to break this chain. You start out with the pathogen. It's on the top there. The pathogen here is COVID-19. It needs to live in a reservoir. A reservoir is our bodies. So that's where it's living, it's in the reservoir. Now for it to spread, it needs a portal of exit. That's you sneezing, that's your coughing, that's your exhaling sometimes. That's the portal of exit. Mode of transmission is going to be through the air. It's going to be on a surface. Portal of entry. Now this is where the other person who doesn't have it yet, this is where they have to be careful, because they're going to have the portal of entry. I'm touching something that's contaminated and now I'm touching my face. Or I touch something and now I'm eating it. Or I'm standing too close to somebody and the droplets land in my face. The susceptible host, unfortunately, because this is so contagious, is all of us. Is all of us. Those with the weakened immune system and others are at a higher risk, but we're all susceptible hosts. So when you look at it, we're trying to find where we can break this chain of infection to stop the spread. Social distancing kind of takes care of it in the easiest and most practical way. So the pathogen exists, our bodies already exist, and if it's in there, how we stop it from spreading? Well, portal of exit. If I sneeze, if I cough, I'm covering with my elbow. I'm not spraying it all over the place. I'm washing my hands regularly, and I'm not touching surfaces. And if I touch surfaces, I clean surfaces. Mode of transmission through the air. Again, 6 feet apart. It's not going to make that distance. It's not going to make it. It's going to land on surfaces. So mode of transmission for surface, again, clean, disinfect. Portal of entry for the other person now, you want to wash your hands. You want to keep that social distance away. But that's how we're going to break it. If you believe you've contracted the virus, stay home, contact your supervisor, and seek assistance from your medical provider. Now, we all know that the N95 masks, the gloves, the nitrile gloves, and the Tyvek are impossible to get. And if you have them, again, send them to your healthcare provider. It's important. For our purposes, for the N95 mask, it's possible to reuse the mask and extend the life of the mask. So if you do have some and you want to hold on to one, you don't have a whole stock of them, but the ones you want to keep your guys using them, that's fine. Remember, we are not treating infected individuals. The purpose of this tradesman's mask is to protect the individual, the person, the worker themselves from possible contamination and droplets from entering your airway. We're not going from patient to patient to patient, worrying about the mask being infected and now contaminating the next person. We're just protecting ourselves. So we don't have to worry about what you hear about, you got to throw the mask away, you got to reuse a different mask. We're not coming in contact with different patients. We're just performing our work, and we need to protect ourselves from the aerosols. That's all we're trying to protect ourselves. Face shield for the splashing, the mask for the aerosols. It has been reported at 3M, and now I also see a report that NIOSH has made a recommendation to medical providers, which also can apply to us, that you can reuse, you can keep and reuse that mask, store it in a paper bag. It's got to be something that's breathable. So you can put it in a paper bag and save it there until reuse again. If the mask becomes damaged or becomes soiled somehow, then you're going to want to replace it. It also recommended that to protect it, wear the face shield. That'll help protect it. Wear anything above, like a surgical mask or anything above the NIOSH one, then too, that'll also protect it and extend the life of it. Remember, tradespeople working on drains events already should be wearing goggles and full face shield. The mask adds another layer of added protection for the nose and mouth. There are other options which will provide it. Like I said, the surgical mask. I'm a Harley rider. I like riding, and I'm from Wisconsin, so it starts to get cold here. So I actually have a neoprene face shield that comes up over my nose and my mouth. Would work. I'm trying to protect the aerosols from coming. Underneath the face shield would work, okay? We're just trying to stop the aerosols from coming in contact with my nose and my mouth. Do not touch your face. It's another way to help prevent it. And again, wash hands, arms, face for at least 20 seconds. The nitrile gloves, while it's best practice to wear the gloves, the inner nitrile gloves, work can still be performed safely without them. Drain cleaning or work performed on a drain or sewer line requires some type of impermeable gloves. They should be durable enough to hold up to the work being performed. So a type of rubber glove will work. We just want to make sure that the liquid isn't coming in contact with our hands. The nitrile gloves, nice added benefit, and love to have it in a perfect world, normal world, but we're working in weird times right now, so we have to make do with how we can. Also important to keep open sores, cuts, and wounds covered with clean, dry bandages. Without a doubt, you need to do that. Again, that's another source that we're coming into. And then wash your hands again, 20 seconds. The Tyvek suits. Best practice recommends wearing at least one liquid repellent suit, like a Tyvek. When working conditions, working on sanitary drains or higher exposure, they recommend doubling up on it. Purposes, again, is protect your skin and protect your clothing and possible spread, because you're going to travel after you're done with the project. You're going to travel back to your car, back to your family. You don't want to leave a trail of contaminated areas. So at a minimum, if you're working where possible splashing of human waste is a possibility, a liquid repellent suit is required. It could be as simple as rain gear, a raincoat, rain pants. You don't have to get the Tyvek. You just want to make sure that it's protecting the liquid from hitting your skin, your body. If you're not going to encounter human waste, then any kind of disposable coveralls would be acceptable. Follow the procedures for the removal and disposal that we covered already. And again, hand washing, 20 seconds. And again, ICRA, if you're working in there in the healthcare facility, you want to follow the ICRA for theirs. So finally, after all this being said, what does this all mean? What's the conclusion of this whole thing? Skilled tradespeople have been performing this type of work for decades. We're constantly being exposed to viruses like colds, flus on the job sites. Sanitary drain systems have always had the possibility of containing viruses. Hepatitis has always been one that we've been dealing with. Now, the nice thing there is there are vaccines from it, and you should have that vaccine for it. But we've always been protected. We know how to do it. We've done it. Through the years, we've learned and we've evolved. We know how to protect ourselves from possible exposure through training and proper use of PPE. Today, we deal with an unknown coronavirus, the SARS-CoV-2. It's highly contagious, yes. and there's no vaccination or no medication available. But using the knowledge and training that we have, along with the CDC recommendations, we've come together as a team here and we put together these best practices. And we put together this presentation for you. Now, we would like to thank all of you I would like to thank all of you that got involved with the development of this program. This team, for me personally, was incredible to work with, and I hope we can do it again, but under better conditions. And I hope that this presentation and the guidelines we put forth is going to help you and your fellow tradespeople remain safe while performing the essential work that we do. And with that, I want to thank you, and I want to turn it over to Cheryl Ambrose for the questions.
Thank you, Scott. Great presentation. And while we've been going on, we've had some really good questions coming in. So I'm going to kind of start at the top here with the first one, and I'm going to toss this one to Brian Kelly because it has to do with HVAC. And the question is from Nick Beasold, and the question is, the guidance we read recommended the workers need full PPE, suits, N95, booties, face shield when working on all rooftop units. Is this correct, or only when working near plumbing vents and exhaust hoods? Most rooftop work our service guys perform is not near vents or exhaust units. So Brian, could you address that?
Sure, I can jump in. Thanks, Cheryl. One of the most important things we need to keep in mind is common sense can take us a long way. Now, if you're not working directly near an HVAC exhaust fan or a plumbing vent, I think you can relax some of these precautionary, and that's what these are. They're guidelines to protect everybody. I mean, the whole reason for this presentation is to help do our part and raise awareness and reduce the spread of the coronavirus. Cheryl?
Okay, great. Thanks, Brian. So the next question, and I'm going to toss this one to Scott. Scott, this is from Javier Rivera, and he asks, can we touch specifically on maintenance workers in hospitals? And I know you've addressed a lot with healthcare facilities, but maybe touch a little bit on maintenance workers specifically.
Sure, love to. Maintenance workers, again, I can't emphasize enough that if you're going to work in a healthcare facility, you want to, at the very least, get in hold of the infection control nurse who's leading up the department of that team of infection control. And you want to understand what their procedures are, what their rules and regulations are as far as infection control while working in there. You're going to use your OSHA knowledge, your OSHA training to protect yourself. But you want to make sure that the work you do, and we're all well trained, and we know how to do the maintenance, and we know how to install better than anybody. There's no doubt about that, but it's all a behavior change when you work in a healthcare facility. You have to think more than just yourself on this thing. You got to think about the other patients in there. And I always tell people when I do this training, you got to pretend that everyone in there is your family member, is one of your loved ones. And every action you take, whether somebody's watching you or not, might have consequences. So when it comes to the maintenance of service work in the healthcare facility, again, make sure that you understand what the infection control program is in that specific healthcare facility. And they're not the same throughout. They're all gonna be different. But you wanna check with them first. And the facilities manager should be able to get you in contact with them. So I hope that answers your question.
Thanks, Scott. The next one came up, and I'm going to toss this to Tom Bigley. This was from Jeremy, and I'm sorry if I mispronounced your last name, Brunhofer. His question was, are the work-specific precautions for all work of this nature or only in high-risk environments? For example, should all sanitary drain work be assumed to have the virus enacting PPE guidelines? And I believe Tom answered it, but if you wanted to elaborate on that, and then maybe Scott, if you wanted to chime in as well.
Thanks, Cheryl. Thanks, Scott, for the great presentation. I think if it's a live sanitary system, you should suspect that it could be in there. So definitely use all the protective PPE, just like you would in a hospital atmosphere. If it's a live sewer anywhere, just figure that their virus could be living in that sanitary sewer. Now, if you're on a new construction site and the sewer hasn't been tied into the main sanitary sewer, then obviously you wouldn't have to worry as much. But if I'm tying into a live sewer, right now I'm thinking it's going to have that virus.
Thanks, Tom. The next question is from Cruz Davis, and I'm going to look to Scott maybe to touch on this. How long does the COVID-19 last on work gloves, leather, cloth, with dipped palms and fingers? I think this is a great question. And I think we may be lacking some research. So anyway, I'll toss that to you, Scott. Thanks.
Well, thank you for tossing that one to me, Cheryl. Again, it's so new, and research, again, because it is so new, they're telling you how long it can be airborne, up to 3 hours. They're telling you up to 1 day on cardboard and a soft surface such as that, and they're telling you 2 to 3 days on plastic or steel. Leather gloves, I couldn't tell you. All I know is once a virus leaves the human body or the animal, it begins to die. And the harsher the environment, the quicker it does die. So on the leather gloves, what I would do, and I'm a germaphobe, I'll admit it, I'll freely admit it. I'm a germaphobe. If I'm wearing leather gloves on a job and I'm afraid that they may have come in contact or been exposed to it, I'm also going to do what I would do with the PPE. I'm going to take those gloves off. I'm going to put them in a plastic bag, a sealable plastic bag. I'm going to wash my hands for 20 seconds. When I need to reuse those gloves again, the contaminant is on the outside of the gloves. I am going to then open the bag up again, slip my hands inside, do the work I have to do, keeping in mind that whatever you touch with those leather gloves on now, you need to disinfect. Your tools, whatever surface you touch, you need to disinfect and treat that as also contaminated. And again, when I'm done with those leather gloves, back in the bag again, wash my hands, disinfect any kind of surfaces that I may have touched with that glove. That's what I would do. But unfortunately, there is no science or research right now that tells them how long the glove stays contagious. Sorry.
Okay, thanks, Scott. So one more question, well, not one more, but the next question would be from Scott Limpus, and he's asking, what is your opinion on fit testing for the N95? Scott, do you want to field that one, or we might toss that to Pete Cheney?
I would toss that one to Pete Cheney because my voice is starting to go.
Well, Pete, there you go.
So the question is the fit testing for the N95s. If your employees are wearing those respirators because they have to, then you have to fit test them as if they were any other sort of a respirator. So just, get a hold of OSHA's respiratory protection standard and just follow it to the letter. And that's the best, safest way to approach that.
Thanks, Pete. Let me see, I'm looking down through here. Pete, this one might be another one for you. This is a good question. Steve Haberberger asked a great question. If a tradesperson contracts the virus, is that considered a recordable injury? And I know you and I have had a lot of discussion about that, and there's been some guidance that's come back, but it's not been abundantly clear from OSHA. So maybe if you want to touch on that.
Yeah, that really is a great question. In our industry, I would not record it, but what I would do is I would just document that it occurred, and keep it with your record keeping, your forms, your OSHA 300 log, your 301, your 308. Just keep it there and just document that you had no way of knowing whether or not it was work related. So for any occupational injury or illness to be recordable, it has to be work related. There's no way for anybody to determine that. I think if you were working in a hospital setting and that particular hospital was treating COVID-19 patients, and a nurse that's working in that unit contracted that virus, I would say that would be recordable. But for our industry, I would never record it, but document it to be on the safe side. That way you'll have an affirmative defense against an OSHA citation if you get one, which I don't think you will. I think OSHA understands what we're up against right now.
Thank you, Pete. And while we're going down through the questions, we had some early questions come in prior to the presentation, so I want to make sure we don't miss that. So we have kind of a twofold question, and this might help some of the other questions along, but someone wrote in and basically asked, how is it possible to maintain social distance of 6 feet on a job site? And so I'm going to ask Scott to answer the first part of that question, and then he's done, toss it to Tom for the second part, and I'll ask that question once Scott has finished his response.
All right, excellent. So how to keep 6 feet social distancing on a job site? Sometimes, I mean, let's be real here. Sometimes it's not possible. Sometimes you're working together in pairs, or sometimes there's a bunch of different tradesmen jammed in the same room because they're trying to get something done as quickly as possible. This is, again, understand how a virus spreads person to person. If I can't keep this 6 feet of social distancing and I'm worried about the aerosols or the water droplets that might leave a person and I come in contact with it, goggles, mask, gloves to protect against anything from coming at me and splashing at me. So maybe it may seem a little bit strange, but again, we're in strange times. If you can't keep the 6 feet, then my recommendation would be some kind of mask to cover your nose and mouth and some kind of protective gear, goggles, whatever it may be, to protect your eyes. Again, if you can't keep that social distancing, that would be my best answer for that.
Okay, and then the second half of the question would be to Tom. And Tom, they also asked, what if you're asked to sign the COVID-19 regulations, which I don't believe there are any, stating that you'll do that? In other words, maintain the 6 feet of social distancing, and this would be coming from the GC or the owner. And so you and or Brian maybe could address that.
Okay, as a contractor, I would ask that general contractor or the end user to forward that form to the office before the manpower is sent to the job site. That way they can have their attorney review that, send it over to the union, have the union review that, and then collectively between the union and the contractor, they should make the decision that if it's in the best interest of the union and the contractor, that they should sign it and then dispatch the members to work. But if their employees are out on the job site and they're asked to sign something before they get there, then I would recommend that they call the office first before they sign anything.
Okay, great. Thank you, Tom. Adam Campbell asks a really great question about working on rooftops, and I'm going to open this up to Brian since we're talking about, rooftops and HVAC, but, Scott, you might want to chime in as well. When working on a roof, is there a distance we should stay away from these vents similar to the 6-foot rule for social distancing? It's a great question.
Scott, do you want to take it, or do you want? I would maintain at least 6 feet, right? Because you're going to have some vapors and potentially some aerosols venting out of those. So, and this is where it's going to be really, really important for the tradesmen across different trade lines. The HVAC technicians are going to have to be extremely aware of plumbing vents that surround them, which let's face it, they typically up to this point they really weren't. And the same for maybe plumbers working on a vent up on a roof. They're not overly concerned about an exhaust fan or the exhaust out of a rooftop. So I think it's important to just raise awareness across trade lines and maintain at least 6 feet. I would certainly recommend. What's your thoughts, Scott?
I agree, Brian. 6 foot for me would be the minimum. And if for whatever reason you have to come closer, again, that's when you're looking at the PPE, again, protect against aerosols from contacting your nose, your mouth, or your eyes. So again, you're right, at least 6 feet.
Okay, thank you, Scott and Brian. Jack Gaza asked a question if using face masks, why store in a paper bag versus a sealed plastic bags between reuse? And so Scott, maybe this is something you could take.
Yeah, I will say it's because that's what NIOSH and 3M have reported to do. They state that it's important, and I don't know the science behind it, and I'm just a plumber. I don't know the science behind it, but they say it's important to store it in some kind of breathable container, and they recommend the paper bag. That's the best answer I can give you.
Okay, great, thanks. I believe we've addressed this question, but I'm going to ask it anyway. Mr. Costello asked, could you work on clearing up the difference between service and service/existing building requirements versus new construction requirements? And I think he's referring more to PPE, particularly where we would be addressing, for example, live sanitary systems and any live systems. So, you know, Scott, if you want to just maybe drill down on that a little bit more, just to make sure we've answered that adequately.
Sure, yeah. Basically, kind of covered the rule of thumb is if the building and the HVAC is being used by occupants within that building, you know, there's sewage running through it, then these guidelines should apply. You want to try to apply them whenever possible. If it's new construction, or if it's something that's not occupied or hasn't been occupied since before this COVID-19 thing started, then you're going to go back to how you normally did business as usual. It's what we're concerned about now is in the occupied buildings and in the sewers and the drains that are being used, the HVAC units that are being used in occupied facilities. That's where you're looking to focus on these guidelines, whether it be construction, whether it be maintenance or service. If there's people working in there, or if people, even if the business has been shut down, but it's shut down after this COVID-19 thing started, you still need to take the precautions because you don't know what may still be living in there. I hope that answers the question.
Thanks, Scott. Okay, so I don't know how long we can go, but we got a lot of great questions, so I'm going to keep asking until somebody tells me to stop. So Jeff Berger asks about, and I had another question also related to hand washing. We had a couple things related to hand washing, and I'm going to kind of cobble these together a little bit. Jeff's question is, with the shortage of hand sanitizer and the lack of hand washing stations on some job sites, are baby wipes an acceptable way to clean your hands prior to eating? Secondly, I had a question about, we mentioned soap and water, so what type of soap? So number one, are baby wipes okay? What type of soap? And are GCs now being required to provide washing stations? So I wanted to kind of throw all those in one lump. And if Scott, if you want to start it off, and then you can toss it to anyone else you want.
Sure. Can I toss it immediately, or should I answer it?
No, well, maybe try to answer one.
All right. Number one, the best, without a doubt, is soap and water. Any kind of soap and water is going to do it. And when you wash hands for 20 seconds, again, it's important to wash back in your hand. Make sure you get the creases. And what a lot of people forget is that our jewelry is underneath the ring too. So whatever jewelry you have, you want to make sure you get underneath there for 20 seconds. If you're not sure what 20 seconds is, sing happy birthday twice. Now, if you're in a public location, you might want to sing it to yourself, unless you're alone, then sing it loud and proud. It's up to you. As far as hand sanitizer goes, it's really has high alcohol content, which evaporates before it's really effective on all germ killing properties. It's good in a pinch. It's really good for finding cuts. But again, hand washing whenever possible. Baby wipes, just a step down from the hand sanitizer. Is it going to clean some of the stuff off? Yeah. Is it going to sanitize your hands? Probably not. I would feel really uncomfortable eating anything if I haven't washed my hands with soap and water before eating. I'm not going to use a hand sanitizer. I'm not going to use a baby wipe. Now, if you're stuck and you're in a situation where, like this gentleman said, that all I have is baby wipes because they can't get hand sanitizer, there's no soap and water available, you can use the plastic when you pack your lunch. Use the plastic bags as your rubber glove that you wrap your food in. So carefully take the plastic bag off and use the baby wipes again to get as much off as you can. and then use that to protect yourself. But I would feel really uncomfortable if I didn't wash my hands with soap and water first. As far as the rest of it, whoever you want to turn that over to, Cheryl, I'll leave it up to you. As far as having hand washing station.
Our GC is now being required to provide washing stations, and you know, I don't know, and I'm going to look at Pete and maybe even Tom and Brian to say, you know, we don't know of anything that's been required. There's nothing, guidance coming from OSHA at this point, just the CDC hand washing guidelines. And if anybody else wants to add to that, feel free.
Cheryl, we're hearing that the big projects that have critical schedules are bringing in additional washing stations, like the nuclear power plant that they're building down in Georgia. They've been bringing in some more of those cleaning stations, but we haven't heard anything that they're being required yet, as far as what I'm hearing from some of the business managers around the country.
Okay, great. And I'm just sorting through questions. I know there's one here that we want to ask, two actually. So Iman asks, what plans do we have in place to deal with porta potties on job sites, as you mentioned, that has a high risk in producing and the continuity of the virus? So that's a good question. And so that Scott, you're back on the screen, so I guess that means I get to toss it to you.
Oh, I should have clicked my pen.
Because, you know, we have to, you know, assume that environment could potentially have risk. So I don't have any specific guidance that I can share. What I would say, and Pete and I could look into this as to what we can do to answer this question after the presentation, I think in a more concise way, and go out and see if we can get some better guidance rather than winging it or putting anybody on the spot. But I wanted to ask it because I think it's a really important question. Pete, do you have anything to add to that?
No, I don't. That's a good idea. Let's research it a little bit and get back with every participant. And I think we have time for one more question, and then we should probably close the webinar.
Okay. So the last one, and I think, you know, this is a good question, and Pete, you and I maybe can tackle this. Mr. Costello asks, when we are working exposed to sewage, etc., bloodborne pathogen requirements would apply. Of course, that's the 1910-1030 standard. And then typically bloodborne pathogens require offering the hepatitis inoculations or vaccination. Should we be following that requirement now? My answer to them, in anytime someone could be exposed or is exposed to, you know, any type of substance or fluid that could potentially carry bloodborne pathogens, yes, they need to be following that. We can't put the coronavirus under the bloodborne pathogen because that's not what it is. And Scott, you want to chime in on that?
Yeah, that's correct. It's a virus, and when you're talking about a bloodborne pathogen, that's going to be it could be a virus too, because again, it's coming from the blood. So you're talking about hepatitis, or it could be bacteria. So it's going to be a little bit different, but yeah, if you have an individual that's going to be working and he could be possibly exposed to a bloodborne pathogen, you're going to want to consider following the OSHA requirements and the vaccinations for the hepatitis. You're also going to want to consider, very importantly, having an exposure control plan in place too, and doing the training not only on bloodborne pathogens, but also at the same time training them on the exposure control plan that you have in place. So in case there is an exposure, that individual knows who to contact, who they should go see, and everything is documented, and also the follow-up and the record keeping on it. So again, cutting into a live sewer and being exposed to possible bloodborne pathogens, I agree with Cheryl. You're going to want to strongly consider following the vaccinations and the exposure control plans.
Thanks, Scott. We have a number of questions that we simply, because of time, cannot get to. But as a group, we're going to sit down with all of the questions that have been asked, and I want to thank everyone for all the questions they've asked. And we'll get some answers put together and looking at putting together a frequently asked question document that we can disseminate out to all the attendees. And I just want to say on behalf of the United Association and General President Mark McManus, we really want to thank the MCA for hosting this and helping us get this important information out to our members and our contractor partners. And so thank you, Pete, and thank you, Tim, and thank you all for participating. They've been on the panel. And with that, I'll turn it back to Pete.
That was fantastic, Scott, Tom, Brian, Cheryl. Thanks to all of you. We really appreciate it. And thanks to all of you who participated today. We hope it's been helpful to you. You know, the sole purpose of this thing is just to help protect our tradespeople all over the country who are still out there working on the front lines. So, and also please just pass the word that this webinar was recorded. It is going to be edited slightly, and it's going to be made available to anyone and everyone that wants it. And it will be made available through the UA, through MCAA, through IAPMO, and through ASSC. So please just watch for the access information, which will be coming out to you very, very shortly here. So with that, you know, thank you so much for what you're doing to keep our workers healthy out there. Everybody have a great rest of the day today, and please stay healthy, everybody.